Welcome to Chapter 10, Video Lecture number 3. In this video lecture, we are going to cover coronary artery disease, hypertensive heart disease, and congestive heart failure. So let's get started on coronary artery disease, abbreviated CAD, which is one of your abbreviations. Coronary artery disease is caused by plaque buildup in the coronary arteries, otherwise known as atherosclerosis. And if you don't know what coronary arteries are, again, the heart is surrounded with these arteries that supply the heart muscle with its own blood. So when those arteries get blocked, it reduces the blood supply to the heart, which can have bad consequences if the heart muscle is not getting the oxygen it needs to pump, but it can also increase the possibility of a blood clot in the coronary arteries, which would then lead to a heart attack. Angina pectoris is pain in the chest during exertion, which is often the first sign of reduced blood supply to the heart's muscle tissue. Usually the pain will go away when the person stops exerting themselves, or if a nitroglycerin tablet is placed under their tongue, the pain will go away. If you didn't know this, placing medication underneath a person's tongue will get it into their bloodstream faster, and there's a term for that, and that is sublingual, and it is on your word list. So sublingual means underneath the tongue, so placing medication sublingually is going to get it into the person's bloodstream faster. Now, if the coronary arteries become blocked, the blood supply to a part of the cardiac muscle is going to be cut off, known as ischemia, and those heart muscle cells supplied by that artery can die. Now, this is called myocardial infarction, which is abbreviated MI, and you probably know it as a heart attack. Now, MI is one of your abbreviations, and infarction is one of your terms. Infarction means a sudden blockage of an artery. So, individuals who may be experiencing a myocardial infarction or a heart attack might have a sudden severe crushing feeling under their sternum, which is the bone that runs down the center of your chest, or left chest pain, and a radiating pain up and down their left arm. If the ischemia is not reversed within 4 to 6 hours, the muscle cells can die, or it's otherwise known as necrosis, which is one of your terms. So if you look at the term necrosis, the suffix osis means a condition, and the root necra means death. So necrosis is the death of cells or tissues. Now, there's 2 types of shock we're going to talk about with the cardiovascular system. The first is cardiogenic shock, which can occur when the heart fails to pump effectively and the organs are not able to get the oxygen they need. If your organs aren't able to get the oxygen they need, they can start to go through necrosis as well. When a person is going through cardiogenic shock, the pulse or their pulse is going to become very weak and rapid, and their blood pressure is going to drop. They might also look pale, they might be cold, sweaty, and anxious as well. The other form of circulatory shock is hypovolemic shock, which is where there is a loss of blood volume, either from hemorrhaging, which is bleeding, or dehydration. Hypovolemic is one of your terms, and it means a decreased blood volume in the body. Cardiac arrest is the sudden stop of cardiac activity due to the heart's electrical system stopping completely. Cardiac arrest is often fatal if appropriate steps aren't taken literally immediately. Death from cardiac arrest is a result of anoxia, which is one of your terms and means without oxygen. So if your heart stops beating, oxygen is not getting where it needs to go, which would obviously kill you. Cardiac arrest is not the same as a heart attack. They're often believed to be the same. They are not the same. A heart attack can cause cardiac arrest, but a heart attack is caused by a blockage that stops blood flow to the heart muscle, which causes death to the heart muscle tissue. Heart attacks are known as a plumbing problem, like there's a blockage somewhere. Cardiac arrest is caused by the heart's electrical system malfunctioning, which stops the heart altogether. So you can think of cardiac arrest as an electrical problem. There is no electrical impulse, which means the heart doesn't beat at all. Next, let's get into hypertensive heart disease. Remember, the term hypertension means high blood pressure. Blood pressure is abbreviated BP and is one of your abbreviations. A blood pressure reading normally is around 120 over 80, but a blood pressure reading at or above 140 over 90 is considered hypertensive. Now, if you don't understand where the numbers come from in a blood pressure reading, the first number is the systolic reading, which is the blood pressure when the heart is contracting, and the second number is the diastolic reading, which is the blood pressure when the heart is relaxed between contractions. So the first number is going to be higher than the second. Hypertension is the most common cardiovascular disorder in the United States, and prolonged hypertension can cause ventricles of the heart to work harder to pump blood, which strains the heart muscles and causes them to be less efficient. And eventually, over time, this can lead to major heart failure, stroke, and kidney failure. Now, there are different types of hypertension. Primary hypertension is the most common type. It is unknown what causes, just basic hypertension, but risk factors usually include being overweight, being stressed out, lack of exercise, and using tobacco and alcohol. About 95% of people who are hypertensive have primary hypertension. Secondary hypertension results from other diseases like kidney disease, atherosclerosis, or hyperthyroidism. Malignant hypertension is rare, but it is life-threatening. When this occurs in an individual, they usually have a blood pressure reading as high as 200 over 120, and when that happens, obviously aggressive intervention is needed. And lastly, prehypertension, which is a systolic pressure between 120 and 139, and a diastolic pressure between 80 and 90. So basically kind of the void between healthy blood pressure and hypertensive, that's pre-hypertension, and that can indicate an increased risk for cardiovascular disease. And lastly, for this video, we are going to talk about congestive heart failure, or CHF, which is one of your abbreviations. Congestive heart failure occurs when the heart cannot pump enough blood fast enough to supply the body's needs. And eventually, blood and other fluids can back up inside of your lungs and your abdomen, your liver, and your lower body. But you might just know congestive heart failure as regular heart failure. A person experiencing heart failure might experience shortness of breath and orthopnea, which is one of your terms. Orthopnea is difficulty breathing when lying flat. So if you're like laying in bed and having trouble breathing because you're laying down, that's orthopnea. Congestive heart failure is usually due to another condition like chronic lung disease, severe hypertension, or like a heart attack, but just thought you should understand it. And that is it for video lecture number 3.